let's pick on diverticulitis. So I want us to know some critical points, some very important points, because there are so many definitions we need to know so far as this particular medical condition is concerned. Number one, what is a diverticulum? A diverticulum is a sac-like protrusion of the colonic wall. So this is the colon, okay? This is the wall of the colon. This is what we call a diverticulum. It is like that sac, which is within the wall of the colon. Okay, now, diverticulosis. So you say that somebody has diverticulosis if the person has many diverticulum, and the many diverticulum are those spaces in the colon wall. So if you say this patient has diverticulosis, yes, because he has all those spaces there. Now, acute diverticulitis is inflammation at like itis, right? Hepatitis, carditis, meningitis, So it is inflammation. Whenever you hear itis, it is because there's inflammation. So inflammation due to microperforation of a diverticulum. So that's hole we saw. If it becomes inflamed because there are small perforations there, then that is diverticulitis. And then we have simple and complicated diverticulitis. So what is simple or uncomplicated diverticulitis? Simple diverticulitis is acute diverticulitis without an associated complication. And this is a very important point. This is where I need you to start taking some very critical points and notes. So what are the complications? When we say complicated diverticulitis, what do we mean? When we say complicated diverticulitis, we are talking about a patient with diverticulitis who also presents with, for example, bowel obstruction. Number two, strictures. Number three, abscess. Number four, fistula. Number five, perforation. So if you see, complicated diverticulitis, don't be confused about it. It's basically bowel obstruction. So bowel obstruction in the context of diverticulitis makes it complicated diverticulitis. Stricture formation in the context of diverticulitis makes it complicated. Abscess formation. Fistula is like a link between the wall of the colon and something else. And you'll realize as the lecture goes on that the commonest fistula is between the bowel and the bladder. And there can also be perforation. Okay. So after we've learned complicated diverticulitis, uncomplicated diverticulitis itself, what's a diverticulum? Now, what is chronic diverticulitis? Chronic diverticulitis is diverticular inflammation that persists for weeks to months. That's when we say this patient has chronic diverticulitis. Chronic diverticulitis. It persists for weeks to months. Okay, so now, how will a patient with diverticulitis present? How will a patient who has diverticulitis present? The most common presentation of acute diverticulitis is abdominal pain. It's abdominal pain. Abdominal pain. Now, most of the time, I'm saying most because it is not all the time. Most of the time, the patient with that presentation has the pain in the left lower quadrant. That's why I use this picture. In the left lower quadrant. That pain can also be suprapubic, so just above the bladder, or in the right lower quadrant. But we know that the right lower quadrant, if a patient presents with low abdominal pain in the right lower quadrant, other diagnosis we also want to think about will be what? Please, can somebody help me? What other diagnosis will you want to think about? Which will come
Acute appendicitis.
appendicitis. So, but then remember that diverticulitis can occur, it is commonly in the left lower quadrant, but it can also occur in the suprapubic and the right lower quadrant. And I've seen somebody, I was sure that this patient has appendicitis, so I did a CT scan and it was right-sided diverticulitis. Okay. The patient with diverticulitis may also present with fever. They may also present with fever. And then they may present with change in bowel habits. And the change in bowel habits can be either constipation or diarrhea. It can either be constipation or diarrhea. Now, I want to move on. If you have a patient, I present a case to you because we are preparing for a board exam, and the patient presents with left lower quadrant pain, and I say that you did a digital rectal exam, and you could palpate a mass in the left lower quadrant, and the mass is tender. One of the differentials, I'm not saying that's the only differential, one of the differentials which should come to mind should be diverticular abscess or distal sigmoid abscess. So you do a digital rectal exam, you palpate a mass which is very tender. It is not the only diagnosis, but one of the diagnoses you want to pay attention to will be, distal sigmoid abscess. Another thing which may happen in a patient with diverticulitis is that the stool may be positive for occult blood. There may be blood in the stool. There may be blood in the stool. Okay. And then most of the time in diverticulitis, it is the sigmoid colon which is affected. But then remember that I told you that diverticulitis can also present with suprapubic pain. And so if it presents with suprapubic pain, what can also happen is that it can be rubbing on top of the bladder. And because it rubs on top of the bladder, the patient may also present with urinary frequency, urinary urgency, and even pain with urination. That is dysuria. So doctors, look at the various ways diverticulitis can present. Left lower quadrant pain more commonly. It can also present in the right. It can also present in the suprapubic region. It can present as a diverticular abscess, which when you do a digital rectal exam, you can be able to palpate a tender mass. The stool may be positive for occult blood. And I said that the commonest presentation of diverticulitis is abdominal pain. Now, I want us to look at something. How are you going to pick up cases in your questions then? If I present you with 69-year-old patient with left lower quadrant pain and blood pressure of 78/42, 78/42 is low. One of the differentials which should come to your mind should be peritonitis as a result of perforation. At the same time, if I present a patient with suspected diverticulitis with shock, it should also lead. So two things I should think about when I see a patient with left lower quadrant pain and the vitals of the patient are unstable, I should start thinking about things like peritonitis and perforation. Peritonitis and perforation. Peritonitis and perforation. Peritonitis and perforation. Please, doctors, is that clear? Can I move on? I really want us to, be able to pick up the clues if we are met with any case. Perforation and peritonitis. So if I see diverticulitis with hypotension, perforation, diverticulitis with shock, perforation, that's all I'm going to think about. Now, if I see a patient with diverticulitis and a tender palpable mass in the left lower quadrant, diverticulitis and a tender palpable mass in the left lower quadrant, I'm going to think about two things. I'm going to think about pericolonic inflammation and peridiverticular abscess. Diverticulitis and a tender palpable mass in the left lower quadrant. Think about pericolonic inflammation. Think about peridiverticular abscess. These are the things you want to think about, right? Okay. So I need someone to read this case for us.
A 65-year-old female presents to the emergency room with a history of left lower quadrant pain, which has been ongoing for the past 3 days. Temperature is 37.9 degrees Celsius, BP 107/70 millimeters mercury, pulse is 78 beats per minute. List 3 complications you are concerned about.
Okay, please now type your answers. So this is a CDM case. Please type your answers. Let's go. CDM, type your answers. I'm seeing some of them. 65-year-old female presents the emergency room with a history of left lower quadrant pain, which has been ongoing for the past 3 days. Temperature is 37.9. BP is 107. Pulse is 78. And what are your differentials? Number one, Dr. Khadija says obstruction. Dr. Nabi says ovarian cyst. I think she's trying to say ovarian cyst. Dr. Khadija says obstruction, stricture, fissure, abscess. Dr. James says peritonitis. Dr. Emmanuel says bowel obstruction, stricture, abscess. Dr. Nabi says ductate diverticulosis. Okay, so this patient has a fever. Okay, this patient has a fever. So list 3 complications you are concerned about. I'm going to think about obstruction. I'm going to think about diverticular abscess. I'm going to think about a perforation. I'm going to think about fistula. Those are the things I'm going to think about mainly. I'm going to think about those ones mainly. Yeah, and the perforation is what is going to lead to the peritonitis, right? The perforation will lead to the peritonitis. Perforation will lead to the peritonitis. So that is that. Okay. Now, remember that I said a quick note about fistula formation in diverticulitis because that's one of the complications. That's one of the things which makes diverticulitis complicated. Fistulas most commonly involve the bladder. Fistulas of the diverticular. If a patient develops a fistula, the most common place it causes the fistula will be the bladder. And the patient may present with pneumaturia. So pneumaturia basically means that as the patient is passing urine, they'll be passing a lot of gas as well because there's a lot of gas in the intestine, right? So as there's the link between the intestine and the bladder, the patient will be presenting a lot of gas. There can also be fecaluria, that is poop in the pee. Poop in the pee. So the patient is peeing and then there's a lot of poop coming out as well. And there can also be dysuria, that's painful urination. So if you see a patient who presents with symptoms of diverticulitis symptoms of diverticulitis, and when they are peeing, there's a lot of air coming out, or when they are peeing, there's fecal matter coming out. Chances are that that patient has developed a fistula between the colon and the bladder. And that is why we are seeing what we are seeing.